So, attempt number 2. Good. All right. We already did one of these, but it shut off about 8 minutes in, so hopefully we can get through this one without any problems. Here's the card I'm going to be using today. All right. Leave that there for just a moment. So I'd like to first begin by introducing myself. My name is Jordan Kennedy. I'm a nursing student with Parkland College.
I'm Lincoln. I'm an anthropology student at Illinois State.
This is Lincoln. I'm going to be conducting my head-to-toe exam on him. Essentially, Lincoln, what we're going to do is we're going to conduct a number of tests. Essentially, I'm going to be looking at you from, obviously as the name of the test indicates, we're going to be looking at you from head to toe. I'm going to be having you perform some basic exercises and also asking you some basic questions. The first thing I'm going to do is I'm going to perform hand hygiene. I'm going to pant my mat. I'm going to go ahead and pretend to wash my hands, soap and water. I will be using gloves during this exercise. So as I get that on, I'm going to just ask Lincoln a couple questions, assessing Lincoln's cognitive ability and his reasoning at this point in time. First, I'm going to start off by asking him his level of consciousness. Lincoln, do you know what day of the week it is?
Monday the 27th.
Monday the 27th, good. And can you tell me what city we're in right now?
Farmer City.
And then, do you want to tell me the name of the President of the United States?
Donald John Trump.
Okay, all right. So we're fully aware that Lincoln is Lincoln's very cognizant, very aware of his surroundings. The first thing we're going to do is we're going to check Lincoln's vital signs. I'm going to check for blood pressure, pulse oximetry, temperature. I'm going to opt not to do blood glucose check at this time. Lincoln said that he's not diabetic. While I'm getting that prepared, Lincoln, could you tell me your height and weight, please?
6 feet, 250.
Alrighty. While I am getting that on, I'm going to go ahead and put that on your finger, sir. And I'm going to check your blood pressure in your right arm. We've got a pulse oximetry reading of 98% and a heart rate of 92. Thank you very much. From observing right now, I'm observing his respiratory rate. I would look at a clock and I would count off 1 whole minute, but we predetermined that his respiratory rate is 17.
This really hurts.
I'm sorry. Blood pressure is 142 over 94. I think the systolic went up 4 points in that. Or, sorry, diastolic went up 4 points since last time. Okay. Go ahead and set that down. And then I'm going to take your temperature. As I'm taking Lincoln's temperature, I'm basically going to observe his basically overall demeanor. Go ahead and underneath the tongue, please. At this time, I'm also going to probably start assessing the skin. What I'm going to look for is skin is basically color, temperature, texture, turgor. Excuse me, we're all done here. 99.5. I'm going to assess for turgor. And then any swelling, edema, and anything like that in the other extremities. So I'm going to probably verbalize that from time to time. I am going to start off by letting Lincoln know that I'm going to start at the top of his head. I'm at a good position right now where I can observe his scalp. I'm noticing any kind of hair formations or lack thereof. Any kind of lesions, anything like that. As I move from the top of his head, I'm going to go ahead and get on his level. I'm going to have him look straight at me, and I'm going to have him go ahead and raise his eyebrows, close his eyes tightly. Good, 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 good. Go ahead and stick out your tongue for me. Good, 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 good. And clench your jaw really tight for me. While I'm doing that, I'm observing for face symmetry. Making sure that he obviously doesn't have any facial droop or anything like that. And noting any other particular issues with that. I do have some rudimentary flashlight. Okay. I do have some rudimentary tools that I just kind of fashioned from cardboard, just so I can kind of pantomime along that. I fashioned this up as a flashlight, and this is an ophthalmoscope. Right now, I'm going to be observing Lincoln's eyes. Oops, sorry about that. So we've already observed that Lincoln's eyebrows can move up and down. While I'm doing that, I'm going to look into his eyes, and I'm going to have Lincoln look up, look down, and look from side to side as I'm observing him. Alright, I'm noticing that he's got excellent movement. And then I'm also going to take a flashlight. Hopefully we're in a situation where this room can be darkened. I'm going to observe his pupillar response. I'm going to make sure his pupils are equal, accommodating, and responsive to light. I'm going to go ahead and I'm going to have you look just right at me as I shine a flashlight in your eyes. I'm going to be observing the right eye for pupillar response, left eye for pupillar response. While I'm looking at that, I'm going to be actually observing the other eye for any accommodation as well. While I'm looking at the eyes with the ophthalmoscope and the flashlight, I'm going to be observing for any changes in sclera, any integrity issues with the cornea. Hopefully be able to observe the back of the retina with this and observe the optic disc. Have you noticed any vision changes or anything like that as of late? No? Okay, good. Let me go ahead and put this. Sorry. Oh my God. That could have been so bad, but no, that's fine. Alright.
Number 3.
I do have an otoscope that I fashioned out of cardboard. I'm going to use this to inspect his ears. I'm going to start off with his right ear. I'm going to inspect and palpate each auricle right now, making sure that there's no problems with skin integrity. I'm going to use my otoscope, and I'm going to basically palpate the auricle, the ear canals, and the tympanic membrane. When I look at the tympanic membrane, I want it to be flat, I want it to be gray. There can be some wax present in the canals, and but just not an overabundance there that would cause him to lose any kind of hearing sensation. How has your hearing been?
Terrible and deaf in my right ear.
Deaf in your right ear?
Yeah. Too much time in the army.
And as I'm observing, everything seems to be well in place. Alright, so we're going to do a couple of hearing tests right now. I've got a a tuning fork, excuse me, not a pitchfork, a tuning fork. It's just fashioned out of cardboard. I'm going to pantomime it, hitting and then vibrating, making sounds. So what I'm going to do is, for this instance, I'm going to go ahead and palpate the right mastoid, or place strike the fork and place it on the right mastoid and ask if he can hear or sense the vibrations, and then when he can hear it whenever I move it towards his ear. Same with the left mastoid, and then do the hearing test on the right side. But we'll go ahead and we'll do a whisper test at this point in time. Essentially what I'm going to do is have you cover your right ear. I'm going to stand behind you. I'm going to say 2 numbers. You go ahead and tell me what numbers I use. Okay.
38. 15-4. 54.
Okay. Same with the other side.
17-6. 76.
Okay, good. And then
98.
All right, excellent. Thank you very much. All right. Next, we're going to be looking at the nose. We're going to be inspecting and palpating the nose, making sure that it's symmetrical, making sure that we've got full range of movement. He's able to kind of crinkle it. I'm going to go ahead and cover up one nostril, and I'm going to observe for adequate airflow out of one nostril and the other. All right, both passages, or both nasal passages, seem to be clear and wide open. Best thing would be to do is probably take a flashlight or a scope and shine up there. Make sure that there's no blockages, no bleeding, etc., etc. All right, so I want you to